Thanks, Mr. Chairman. I want to commend and thank you for your leadership. I want to especially commend those who spent, what was it, 61 meetings with you and trying to find a way to a bipartisan proposal. I want to express my thanks to all of our colleagues on this committee.
In the interest of accuracy, it's 61 hours.
I'm sorry. All right.
But it felt like many, many more.
I'm sure it did. I want to especially thank our staff, Finance Committee staff, Democrat and Republican, as well as our personal staff for the enormous effort and time that they've invested in this process, and all those that have come before us in the course of this year and last year before I joined the committee to give us the benefit of their input. I believe that with the passage of this bill or something close to it, we'll begin to move to transform the healthcare system today that costs more than any on earth, does not provide better outcomes, results in some 14,000 people losing coverage every day, leaves over 48 million people without coverage, and puts American companies at enormous competitive disadvantage with their business rivals around the world. There are many facets of health reforms that are necessary and integral in adopting sound health reform policy, but I want to make, if I could today, special reference to three that have been major priorities for me and I know for some of our colleagues. One of those is reining in the growth of healthcare costs. The second is moving away from fee-for-service delivery system. And the third is encouraging wellness and incentivizing healthy behaviors, more healthy behaviors. I believe that July 16th, 2009 was a game changer in the debate on healthcare reform. On that date, Senator Conrad, as chairman of the Budget Committee of the Senate, asked CBO Director Doug Elmendorf if any of the health care reform bills up to that point reined in the growth of health care costs. As I recall, Dr. Elmendorf replied no, and went on to say that health care bills up to that point significantly expanded the federal responsibility for health care costs. On that day in July, we did not yet have a Finance Committee package to examine. We now have a Finance Committee package. We've heard back from CBO on that package. We've heard that our package would expand health insurance coverage to 94% of Americans, up from 83% today. We've heard that our package as a whole costs some $829 billion over the next 10 years, significantly lower than the other reform proposals in Congress, and I might add, fully offset, fully paid for. In fact, it provides a net surplus, I believe, of $81 billion over the next 10 years, and over the next 10 years beyond that, a surplus added of as much as $800 billion. I've made it clear to my colleagues and to all who will listen that I'm not interested in voting for a bill that increases our national debt and does not begin to rein in the growth of health care costs. Over the last several months, I've become convinced that one key piece of reforming our health care system is moving away from our current payment structure of fee-for-service, a view that I think is widely shared by others on this committee. The current payment structure of paying health providers for each health service that they provide stifles collaboration, suppresses efficient care management in many instances. During the visit that I've shared with all of our colleagues about a month ago to the Cleveland Clinic, a nonprofit healthcare delivery system that's moved away from fee-for-service and now pays its doctors a salary, I saw firsthand what can be accomplished when we move away from fee-for-service, when we create a patient-centered model of care that focuses on primary care, prevention and wellness, managing chronic diseases, and harnessing information technology for the delivery of health care. Although we can do more, our Finance Committee bill takes a number of important first steps in moving away from our current payment structure. One of the provisions in our finance package that many of us believe can be a game changer in this regard is the creation of CMS's Innovation Center. And later today, I'll ask Dr. Elmendorf to talk with us a bit more about that. But the Innovation Center's purpose will be to test, evaluate, and expand different payment structures and models which aim to foster patient-centered care and to improve quality. In addition to reining in the growth of healthcare costs and moving away from fee-for-service, I believe that encouraging wellness and incentivizing healthy behaviors are critical to reform. We know that if we incentivize people to take better care of themselves, we can rein in the growth of our healthcare costs as well. And recent findings have shown us that the biggest factor contributing to most people's health status is their behavior, our behavior. And roughly 40% of our health status, I'm told, is a direct result of our choices about food and physical activity. Another 20% is a direct result of social and physical environments, such as our homes and the places where we work. That means for most people, the way that we eat, the way we drink, the way we exercise or don't, as well as our work and home environments shape as much as 60% of our underlying health status today. I was pleased to work during markup with Senator Ensign to fashion a bipartisan amendment that will better enable employers to incentivize employees to address some of the major causes of poor health that lead to higher health care costs. What are they? Smoking, obesity, high cholesterol, high blood pressures, among others. Let me conclude by saying none of us is suggesting that our committee's proposal is perfect, but I do believe it represents an important next step. And today I hope that we will report out of committee a finance package that will provide us with the foundation as we move forward and merge two health care bills in the Senate. The American people are counting on us. We cannot afford to let them down. Thank you.